Hey everybody, Cara Haden here with Pipestone. Hey, just wanted to throw out another quick video. Just wanted to cover the basics of antimicrobial resistance, what exactly I mean when I'm talking about antimicrobial resistance, and just to make sure that we're kind of all on the same page. So I promise there will be some other videos coming out talking about what we've done, but this is just a foundational video to make sure we're all on the same page. So what is antimicrobial resistance? It's really simple, right? It's if you have a bacteria that is carrying a little piece of DNA or a gene, right, that allows that bacteria to survive in the face of antibiotic use. So bacteria carries resistance gene to antibiotic A. We try to use antibiotic A. That bacteria survives in the face of antibiotic A. That is antimicrobial resistance. So what does it cause if you have bacteria that carry resistance genes, right? There's three potential outcomes for that. So one is the worst outcome, and that is where you have someone who gets an infection with a bacteria that carries resistance genes for multiple antibiotics. And there are bacteria that carry resistance genes to all of the antibiotics that we have available. And so the outcome in those situations are very poor, right? Those people go in to get treated, the antibiotics don't work, the doctor does a susceptibility profile, finds out it's a multi-resistant bacterial infection, and then they really don't have any antibiotic options in that case. And so that's where we start seeing alternatives that are tried, things like amputations, and where some people eventually do succumb to those infections. And so that's that number, that 35,000 people a year in the United States pass away from infections related to antimicrobial resistant infections. So that is not a good outcome, right? So that's outcome number one. It's the most rare of the three outcomes. So outcome number two, if someone is infected with a bacteria that carries a resistance gene, let's say it's a resistance gene to antibiotic A. So antibiotic A is tried, it doesn't work. And so basically the doctor does a susceptibility and finds out, oh, this bacteria carries resistance to A and C, but antibiotics B and D would work on this infection. And so ultimately the patient is healed. It just takes more time, right? They're sick for longer. They lose out on more work. It's more work for the healthcare system. And so it's not the best outcome, but it's obviously better than outcome number one. And so that would be more common, obviously, than outcome number one. So outcome number two is just increased in treatment time, even though patients do survive and the infections get under control. Then outcome number three is that you are exposed to bacteria carrying antibiotic resistance genes every single day without any infections that lead to life-threatening illnesses. And so we know that this is true because there's been a lot of testing done in this area. So we know that if you swab a fair number of healthcare workers, veterinarians, nurses, doctors, they will carry staph infections, so a staph bacteria, in their nasal passages that carry resistance genes. And those people are not sick. They don't have any negative impacts that we know of from being carriers of that particular bacteria. So we also know that if you test the soil, if you test a lot of different areas in nature, fecal material, there's all sorts of stuff that if you test it, you will absolutely find resistance genes there that are not causing any disease. And so that's by far the most common case, is that resistance genes are present and people are exposed to bacteria that carry them without negative impacts. And so that doesn't make outcome number one or two any less important to focus on, but it is important to note that just because a bacteria carries a resistance gene doesn't mean that that bacteria is somehow a super powerful bug that is going to kill people. So I just wanted to kind of set that foundation and make sure that we're all on the same page moving forward about what antimicrobial resistance is and what we're talking about. So again, subscribe to the page, make sure that you like it, make sure that you share it, and we will keep throwing more and more videos out there. Thanks.